Good morning, all of you. So many patients, they ask me what is the, like a basic treatment is available on CFC. So many people think that, like a CFC means only a IVF treatment or maybe an advanced treatment like a PGD, PGS or PGTS or something like that. So we are going to explain about basic treatment, what is, available in CFC. And this video is mainly for patient education. So this video mainly for, I'm again telling you, this video is mainly to educate the infertile couple. So generally, what is the infertility? Infertility, like a 12 months, they are trying seriously without any, like a obstacle. That means they are not taking any contraceptive pills, they are not using any condom. So they are seriously trying for 12 months natural intercourse. They are not getting pregnancy. So if they are not getting pregnancy for, like a 10 to 12 months, we call as infertility. So here what we have to do is, so if they are seriously thinking for a baby, they must visit an fertility centers. So once they visit fertility center, what we do is exactly we counsel them thoroughly. So what exactly happening? So male and female both couple, we counsel them, and then we may understand what exactly they are going through. So once they come to CFC or Chennai Fertility Center, what we'll do is, after counseling, we do the blood test for husband, and we also do a blood test for wife. So these blood tests will give you more information. Like a screening profile we do, hormone profile we do, thyroid profile we do, and we also do a special test called as a AMH. This is basically for a woman. So any like a patient coming to the CFC, basic treatment, once they are coming for basic treatment, so first we need to do a blood test for wife as well as a blood test for the husband. So husband, generally we do a screening test, like a HIV, hepatitis B, VDR, all the screening tests will be done, and we educate them, 3 to 5 days of abstinence, they must do a semen test. So they have to come to CFC, 3 to 5 days of abstinence, you will masturbate and produce a semen sample. And we keep half an hour for liquefaction. After that, we start taking 1 drop of semen and then to examine in the macular chamber, and we find out what exactly this sperm count says. So normal sperm count, basically it will be around like a 15 million and above, 50% motility, at least 4% morphology has to be there. If it's there, that's called as a normozoospermia. Sometimes if this varies, or if they have a less sperm count, say for example less than 10 million is there, we call as a oligozoospermia. Or morphology is less than 4% is there, we call as a teratozoospermia. So these are about the male infertility. So they come, they give a semen sample, and we found out whether it's a normal or any variations there, we find out. This is about the man. A healthy woman should have a 2.5 to 3 AMH and antral follicle around 9 to 10 follicle each side. If it's there, it's a good, the ovary is very, very healthy, and the number of follicle also fine, and the AMH also 2.5 to 3 is there, they are the perfect. So these two information, if husband semen sample and the like a ovarian volume and number and AMH, you can plan the like a treatment about this particular couple. In case ovary is fine, the number of eggs also fine, number of antral follicle also fine, but still they are not getting pregnancy. That means we have to rule out whether any tubal pathology is there. That means we have to check like both tubes, left tube and right tube. Simply we can do a saline sonography or maybe HSG, and then we can do an X-ray and then find out whether tubes are healthy or unhealthy. So in case any hydrosulfix is there or tubes are blocked, in spite of everything, like husband sample is fantastic, and like ovarian result also fine, and like the number of antral follicles also okay, but tubes are not good, the woman cannot get pregnant. So for those patients, simply doing for like ovulation induction, giving tablets for like 6 months or 1 year, that may not work out. And if you are simply doing IUI without checking tube, washing the semen and pushing into the uterus, that also may not work out. or maybe doing a laparoscopy and then checking the diagnostic laparoscopy, checking the ovary and then uterus, everything, that also will not work. This particular patient, you must go for an IVF treatment. So the take home message here is, if the husband sample is very good and the wife ovarian reserve also fine, and then wife AMH also fine, antral follicle also fantastic, but if the tubes are not healthy, if the tubes are tubal blockage is there, they must go for IVF treatment. So the take home message is, they must go for a IVF treatment if the tubal pathology is there. Thank you.